I'm Dr. William Millsaps Raspberry Jr. I'm an internal medicine hospitalist physician. So I came into the program pretty open-minded. One of the motivations I had for doing it was some of the people that have been my mentors and leaders within hospital organizations have moved on into executive roles, and they require them to have an MBA in order to take that position. And while I didn't have any specific goals in mind, I wanted to keep those opportunities open. So the things that I have taken away from the program to use in my day-to-day practice of medicine, a lot of the operational excellence tools in trying to improve quality, efficiency, and particularly in sepsis bundle protocol utilizations, which actually saves lives. One of the most fun memories I have is going to Chile. It really exceeded my expectations. And one of the best memories I have is the trip to DC. I thought that was the strongest part of the program. My class cohort was very supportive, and we worked very well as a group, and that was what I leaned on to get through the program. I found my cohort to be very diverse in backgrounds, interests, and experience, and so that enabled me to reach out to people to, meet specific needs or learn about things that I had no idea about prior to the program.